non-chillness. Greetings to all of you. This video is the second part of medical or nursing terminologies. Today we are going to see 25 terminologies which starts with the alphabet A. Let's go into the video. The first terminology for today is acalculia. Acalculia is a term which is used to describe inability of a person to perform simple mathematical calculations. Acalculia is a term which is used to describe the inability of a person to perform simple mathematical calculations. This is due to the presence of lesions of various areas of the cerebral hemispheres. Second one is acampsia. Acampsia is a term which is used to describe stiffening or rigidity of a joint. Acampsia is a term which is used to describe stiffening or rigidity of a joint. Next one is acanthamoeba. Acanthamoeba is a microscopic organism. It is a type of amoeba which is found in sand, dust, heaters, ventilators, freshwater, seawater, humidifiers and dialysis units. It will cause infection which is very fatal. Next one is acapnea. Acapnea is a term which is used to describe lower levels of carbon dioxide in the blood. Acapnea is lower carbon dioxide levels in the blood. Normal carbon dioxide level in the blood is 23 to 29 milliequivalents per liter. If the carbon dioxide level is lesser than 23 milliequivalents per liter, then it is termed as acapnea. Next one is acardiac. Acardiac is a term which is used to describe without a heart or lacking of heart. This condition is more common in conjoined twins. The next terminology is Carricide. Carricide is an agent. It is usually a chemical that is used to kill mites. Carricide is an agent that is used to kill mites. Next one is accessory nerve. Accessory nerve is the 11th cranial nerve which supplies sternocleidomastoid muscle and trapezius muscle. It helps in the turning and nodding of the neck and elevation of shoulders. I have explained about accessory nerve in previous video. If you want more information about accessory nerve, you can use the link which is given in the description box. Next one is acclimating fever. Acclimating fever is an elevated body temperature with malaise or general body weakness that affects persons who are working in very hot environment. Acclimating fever is an elevated body temperature with malaise that affects persons who are working in very hot environment. Next one is acetone. Acetone is one of the ketone bodies which are formed when the body uses fat instead of glucose for energy. The presence of ketone bodies is an indication that the cells lack insulin or they cannot use effectively the available insulin as seen in diabetes mellitus. Next one is acetonuria. Acetonuria is a term which is used to explain the excretion of large amounts of acetone in urine. Acetonuria is the excretion of large amounts of acetone in urine. Usually acetone is not excreted in urine. Usually it is absent or negative in urine. If acetone is excreted in the urine, it indicates that the patient has diabetic ketoacidosis. The next terminology is abrasion. Abrasion is a deviation or irregularity. Abrasion is a deviation or irregularity. For example, chromosomal aberration is a term which is used to describe the deviation from the normal number of chromosomes or a deviation from the normal structure of chromosomes. Mental aberration is a term which is used to describe mental illness. So, aberration is a deviation or irregularity. Next one is abeyance. Abeyance is a state of temporary cessation of function. Abeyance is a temporary suspension of sensation, activity or pain. The next one is ABR test. ABR test is a short form of auditory brainstem response test. Auditory brainstem response test. In this test, electrodes are placed in the skin around the ear to record the electrical activity from the auditory nerve and parts of the brainstem. This test is used to evaluate hearing integrity and neurological integrity. The next one is Abraham's heart reflex. Abraham's heart reflex is a contraction of myocardium due to the irritation of skin of precordium. Abraham's heart reflex is a contraction of myocardium due to irritation of skin of precordium. Precordium is the region on the chest wall over the heart. The next one is absorption fever. Absorption fever is an elevated temperature without any other symptoms that usually occurs shortly after childbirth due to the absorption of uterine discharges by the vaginal walls. The next terminology is Acetylcoenzyme. Acetylcoenzyme is a term which is used to describe the inflammation of the skin or eruption of the skin due to mite infestation. It is an inflammation of the skin or an eruption of the skin due to mite infestation. Next one is akathexia. Akathexia is an abnormal release of secretions. It is an abnormal release of body secretions. Next one is accountier. Accountier is a term which is used to refer male obstetrician. Obstetrician is a doctor who specializes in pregnancy, childbirth and a woman's reproductive system. Next one is accountius. Accountius is a term which is used to refer female obstetrician. Next one is acetabulectomy. Acetabulectomy is an excision or removal of acetabulum. It is a removal of acetabulum. Acetabulum is already explained in the previous video. If you want to get information about acetabulum, please use the link given in the description box. The next terminology is acetylcoenzyme A. Acetylcoenzyme A is an important metabolic intermediate which is derived from various pathways such as glycolysis, oxidation of fatty acids and degradation of some amino acids. It is commonly referred to as acetyl-CoA. Next one is acetylcysteine. Acetylcysteine is an antioxidant drug which is used to reduce the thickness of mucus and it helps to remove the mucus from the respiratory tract very easily. Acetylcysteine is also given to reduce the toxicity which are produced due to high doses of acetaminophen. Next one is acetylcholine. Acetylcholine is a neurotransmitter which are released by the nerves that is essential for the communication between the nerves and the muscles. Next one is achalasia. Achalasia is a rare esophageal disorder which is caused due to the damage of esophageal nerves. Due to this, the lower portion of the esophagus become weak and the lower esophageal sphincter will be closed. It is failed to open. So, the food and fluid which is taken by the particular person will not be passed into the stomach. So, the undigested food will be regurgitated back into the esophagus. Next one is ache. Ache is a dull, poorly localized pain and it is less than severe in intensity. Dear viewers, thank you for watching the video. If this video is found to be useful, kindly like, comment and share the video with your friends. If you are new to our channel, kindly subscribe our channel and please do not forget to press the bell button to get notifications whenever we upload new videos. Thank you. Have a nice day.